Okay, good afternoon, everyone, and welcome to today's Road to November webinar, Social Work and Voter Mobilization. I'm Jeff Feldman. I'm the Director of Advocacy and Communications at the NASW New Jersey chapter, and I am very happy to be here today with partners for our panel discussion. Really quickly, let me also welcome not just those of you who are here joining our webinar live, but also those who are watching the live simulcast, which is available on the NASW New Jersey Facebook page and on the Social Work Helper Facebook page. I'm introducing the panelists shortly. If you have questions for the panelists, just enter them in the chat in the webinar, or you can enter them in the comment box on the Facebook page, and we'll be monitoring those pages to try and feed your questions to the panelists. Also, this webinar is being recorded so that we can have people access archived version afterwards, so please just be aware of that. And also to just keep yourself on mute unless we're opened up for discussion and you need to would like to address the group. And depending on how many total participants we have, will help determine if we're able to do that. Anyway, welcome again to the webinar, and I'm very happy to present today's panelists. With us today are Tanya Rhodes Smith, MSW. Tanya is the director of the Nancy A. Humphreys Institute for Political Social Work and instructor in residence at the UConn School of Social Work. She is also co-founder of the National Social Work Voter Mobilization Campaign, which you may have seen online as Voting is Social Work. And as the director, she has overseen the expansion of the Institute's Campaign School for Social Workers, which has trained more than 2,000 social workers to run for elected office and lead in politics, and supports nonpartisan voter engagement as a social work intervention. Our second panelist will be Alberto Cifuentes Jr., LMSW. He is the social work team lead for the Vote ER Healthy Democracy team and a doctoral candidate and graduate assistant at the University of Connecticut School of Social Work. He has spent much of his professional career advocating for underrepresented and marginalized communities through direct action, community organizing, and social justice education. Alberto currently serves as founder and chair of the Macro Social Workers Network of NASW Connecticut and the co-chair of the Latina Social Workers Network of NASW Connecticut. And our final panelist will be Deona Hooper, MSW. Deona is the founder and editor-in-chief of Social Work Helper, or SW Helper, and she has experience in nonprofit communications, tech development, and social media consulting. Deona has a master's in social work with a concentration in management and community practice, as well as a certificate in nonprofit management, both from the University of North Carolina at Chapel Hill. So welcome to all of our panelists. Thank you for joining us today. And I'm going to turn things over to Tanya now to kick us off with her piece of the discussion. If you need to share your screen, Tanya, you should be able to do that now. Otherwise, we're good to go.
Hi, everyone. It's really a pleasure to be here. And I will share a few slides. I hadn't thought I would, but I'm going to. And I figure I'll just take about 5 minutes and tell you why we believe this is so important. And let's see if I can do this. Some of you, I know a few of you, so you've seen some of this, but as he said, I'm the director of the Nancy A. Humphreys Institute for Political Social Work. Jeff mentioned that I'm also at the UConn School of Social Work. And so our mission is really to increase the political participation and power of social workers in the communities we serve. So we do that through our campaign school and through our efforts to train social workers and support all social workers to engage people to vote as part of their practice, whether they are in clinical practice, whether they are in community practice, or whether they are working in what we would call macro practice, in advocacy or working in political settings. So we do that because, oh, let me see. I'm sorry, see if I can share this. This is probably better. So you can see this now. And I will start by saying that an inclusive democracy matters to all of us, because an inclusive democracy works for and responds to all individuals. And what we know is that elected officials pay attention to communities and individuals that vote. So who votes matters. It matters a lot. Who is in office matters. We know that when we have diverse representation, that we get better laws and better response and better representation. We know that who is counted in the census matters to the money and the funding that we receive at all levels of government. It matters to the political power and how lines are drawn and given to all communities at all levels of the government. So the census matters. And who is actually advocating and in influencing legislation and public policy matters. So social workers belong in all of these spaces. And today we're really here to talk about who votes matters, but it connects to who's in office, because there is a very famous quote that I'll try to remember off the top of my head, but it's far easier to spend some months and a little bit of money getting the right people elected than to spend a lot of time and a lot of money getting the wrong people to do the right thing. And that was said by Senator Debbie Stabenow from Michigan, who is a social worker, of course. Oh, there it is. I forgot that I even had it on here. So we do train people to run for office. But this idea that we're here today to talk about is that voting matters and who votes matters. And we had 100 million people in the last presidential election stay home. And what we know about non-voters is they're far more likely to be lower income, have lower levels of education. They're likely to be non-white, even though there's a large variation between populations. So I don't want to generalize it or suggest that there is a standard narrative there. And they're more likely to be single. But what's important for you to know is two things. 100 million people stayed home when it was a presidential election. The turnout for local elections is far lower, but that the systemic barriers that we talk about a lot, so felony disenfranchisement, all those things that make voting hard, the practice of voting hard, they are also fed intentionally and unintentionally by the engagement barriers. So a lot of people, the number one reason people don't vote is they believe the system is rigged, or they believe their vote doesn't matter. So that's an engagement barrier. And again, I believe it's so important for social workers to be in this space. And we also have a pandemic on top of this, and we're having these conversations finally on a national level, acknowledging that racism is built into the structure of our democracy. And it is really important that we address these systemic barriers. We're going to have to try to rise through them and push people to vote in the next 3 weeks, but we also have a responsibility to address the systemic barriers and the systemic racism that is built into our democracy. But when we speak about what I mentioned earlier is I want you all to think about not just who's at the top of the ticket in this election, but who's in the down ballot. What we call a down ballot is anybody below the governor, the constitutional officers in your state and below. And so those are your state legislatures, your all your elected officials on the county level and on the local level. And what happens is that turnout is often far lower. It's higher in the presidential elections, but often municipal elections are run in non-presidential years. State elections are often run in non-presidential years. And what happens in the municipal turnout, when you have people on the local level turning out at 10 and 20%, that is a toxic amount of power for people. And this is where really important laws are being made. We have the most accountability, direct accountability to elected officials, and yet we often give that up because we don't participate, particularly in communities that are underserved because they don't have online candidate guides, or they don't have people telling them that their vote matters and asking them to vote and giving them opportunities to register. So I think that's really important. We can talk more later. I'm going to turn this back over to everybody, but just remember that these structural barriers limit participation because they also create these engagement barriers. And so that's why we really think that social workers belong here. And I'm going to stop here and turn it over to my colleagues, and then we can hopefully have a robust discussion.
Great. Okay, thank you so much, Tanya, for that great introduction and setting us up for our conversation today. One question before we move on to Alberto's presentation that I thought it might be important to address right now that I didn't want to lose track of. You talked about the importance of voting down ballot and how people often are not voting in their local elections and aren't doing the down ballot voting. One of the things I'm wondering is I feel like a lot of people may not vote in the down ballot elections because they don't know the candidate information. Do you know, how can people find out platforms and information about their down ballot candidates? Because you don't hear as much about it. You don't have, the televised debates like they have for presidential debates, and it doesn't get the news that the congressional elections get. So where do people find those resources so that they can be informed when they vote down ballot?
Well, I wish I had a magic answer for you, but I'm going to try to address this. And I think Deona will also have something to say, and Alberto as well. But what we know is that it is very hard. If you just looking up at who represents you at every level of government, when you start to get lower down the list, it's challenging. There is, in very few places do you get one website that'll tell you from top to bottom who represents you. So you have to be intentional in going and looking up your state legislators and your state representatives versus your local representatives. And that takes some effort, right? And then what we also know is that in the old days, the newspaper would often be the place that the League of Women Voters would have a nonpartisan voter guide. But those don't really exist anymore in a lot of our communities, and particularly in our communities that are underserved and may not have a robust nonpartisan civic organization like the League posting things online. So I would say, first of all, vote411.org, which is run by the League of Women Voters, is a place to go. Virtual is also going to help. In the past, you had to physically attend candidate debates, local candidate debates. Often they weren't often recorded. It wasn't often accessible for the average citizen, and so I think those are more often available. There is some new technology coming. So Ballotpedia, which can give you in some locations your top to bottom. I would start with Ballotpedia, but they're launching a partnership with a group called NCIV, and NCIV is giving candidates the opportunity to upload videos. So, again, statements about videos, but non-voters in general, the other thing that came out of the research and the analysis of those who didn't vote in 2016 was that they're much more passive about recipients of news. So they're more likely to get their news on Facebook and social media. So I think those of us who are interested in democracy need to help. That's another role for social workers. We connect people to information all the time. So again, it's location to location, but I would start with Vote 411 and Ballotpedia.
Thank you so much, Tanya. I appreciate that. And Helen has asked what we can do about reaching the 100 million who don't vote. I think we could probably spend a lot of time on that discussion, but it's actually a good segue, I think, into Alberto's piece to talk about the work that VoteER is doing to try and reach people through the healthcare system, I believe. So, Alberto.
Hello, everyone. Thank you, Jeff. And I just want to say, in all transparency, and just because Deona and Tanya are two of my best colleagues, I really appreciate and I'm grateful for the work that they do. And they are partners. The Nancy A. Humphreys Institute and Social Work Helper are both partners of VoteER. So we're all doing this work together. We all have different ways that we're doing this, but we all share a common purpose. So I just want to reiterate that. I'm going to show you one tool, just one tool, and you can put in your toolbox for engaging people in voting, in voter recruitment, engagements, and knowing how to vote safely. Because VoteER is something that came from the medical establishment. It came from hospitals and healthcare professionals. And so the focus is not just on voter recruitment and engagement, but it's also on how to vote safely. So voting by mail, voting absentee, or if you're voting in person, knowing to bring a mask, wear a mask, use social distancing, and getting poll workers, getting young people who are less vulnerable to getting COVID to become poll workers. If I'm still considered a young person by today's standards, I'm going to become a poll worker for the first time, because I know that many of the people that were poll workers when I was voting are in the vulnerable category for COVID and are saying, I need to step back and let other people do this. So I'm going to share some slides. Do that in 1 second. Okay, and then let me start the slideshow. So around, oh no, not play from start. Oh, gotta love these technical. Okay, so we're gonna play it from the current slide, and I have it around my neck right now, the actual VoteER badge backer that many social workers, actually about 500 to 600 social workers have used. Tanya has it, have used to register people to vote. And it works in 2 ways. One, there's a QR code that people who have a smartphone can scan so that they can check if they're registered to vote, or if or how they can vote by mail, or they can text vote SW to 34444. So that's it, and it's on the slide. So, but let me give you a little bit of history in terms of what is VoteER. The mission of VoteER is to promote a more inclusive American democracy. And as Tanya was stating earlier, the goal in making sure there's an inclusive American democracy is that all voices are counted, not just those that have physical, monetary, financial power, ideological power, but that all voices are included and have a voice at the table. And we're creating a future where those most hurt by our healthcare system, because we agree our healthcare system is far from perfect and has a lot of issues. But the best way we can go about actually trying to figure out how to repair and reform, or in many cases, transform this healthcare system, is by inviting everyone into the democratic process. So inviting all voices, healthcare professionals, clients, patients, and especially social workers. Okay. Oh, let me go back. So in terms of what our core values are, in terms of our core beliefs, well, we believe that voting is a social determinant of health. That we believe that empowered communities, once empowered communities are given the resources and the tools to vote, to participate in American democracy, that will lead to positive health outcomes. Actually, there's research, a lot of research that shows the connection between voting and healthy outcomes. We also believe that we can, by giving everyone a voice and letting everyone share their story, tell craft their narrative, so why voting is important to them, we can actually work to change the things that need to be changed. And lastly, we really do believe that more voices build better systems, that our healthcare system is stronger when everyone shows up, not just those in power, not just those providing services. Together, we have helped 40,000, I think it's over 40,000. This was from like a week ago. So we have over 40,000 people who have registered to vote and are getting ready to vote or voting by mail. Our founder, Dr. Alistair Martin, he is an ER doctor at in Boston, Massachusetts General Hospital. And he came up with this he can tell the story better than I can, but I will give you the Reader's Digest version of the story. He had a patient who was living in her car. She had children. She didn't know where to turn. She needed help, and he wanted to help her, but she didn't have insurance. She needed ID. What can we use so that I can actually provide her with services? And he consulted a social worker, and the social worker asked, well, is she registered to vote? Because if she's registered to vote, then you can further help her and provide her with those services. So that's when a light bulb went off in his head, saying we need to connect voting with healthcare, and we need to ensure that people are registered to vote so that they can be given quality healthcare, so that they can be that their voices can count, and they can be given services regardless of their income, of their age, of their race, ethnicity, etc. So he and his team created, with many partners, including Voting is Social Work, Nancy Humphreys Institute, Social Work Helper, created multiple levels, multiple tools for doing this. The one that social workers use most often is this Healthy Democracy Kit, this badge backer. And as you can see there, it's free. The first 10, I think, were free to everyone who registered, who got it. And it tracks the number of registrations. That's how I was able to give you over 40,000. It tracks the number of registrations by social workers, physicians, and medical students. This program has been heavily tailored and I would say marketed towards medical students and healthcare professionals. So they make up the majority of people who use this. But social workers have been steadily climbing in terms of number. And it doesn't just track the number of registrations that social workers, physicians, and medical students make, but also the number of mail-in ballots that are requested. And there are actually a few more options, which I'll introduce to you in a little while, because we have less than 3 weeks to the election. So we had to change some of those options. But the whole trick to the badge backer and the lanyard is usually it captures people's attention. And people are like, what is that? What do you have around your neck? Or the doctor or social worker says, are you registered to vote? Here's a way to register to vote. And so we have little scripts that you can use that this is all you have to do. Many of my students have used this. My social work students have used this in their field placements. And all of them have said this is easy to use. They've had really good results. People have been able to register to vote. So I know it works. And in terms of the QR code, so when people really scan that QR code, right now, before 10/20, which is coming up, you can either register to vote, because for some states, the registration deadline has not passed. You can either vote today in those states that have early voting, or you can triple your vote, which I'm going to tell a little bit about in a minute. But we also have it in English and Spanish. And of course, after 10/20, it's just going to go down to vote today and triple your vote. But let me talk today about triple your vote, because it's actually, behavioral science research has actually shown that when you secure someone's promise to encourage 3 friends to vote and follow up with a text reminder, it works. And it's cheaper than other tactics. So it's really meant for non-activists, for the 97% of voters who will cast their ballot on election day and don't necessarily volunteer for their campaigns. This is a really easy way. Some campaigns call it vote tripling. We tend to refer to it as tripling your votes, which means you're going to encourage 3 people, at least 3 people, to vote and send them text reminders. And we actually make that easy because we actually have that set up. So when you click on vote triple or triple your vote, the option before, we can actually send reminders for you or help you facilitate that process. So this is remind your friends, in other words. We have that, and we'll have you fill out a form, and we'll facilitate that process of reminding them. And
Alberto, if I could interrupt just for 1 second.
Yeah, go ahead.
Is there a page on the VoteER website for the The vote tripling?
Yes, it's the remind your friends to vote. Yeah, there is a page. Yes,
All right, I just want to put a link
I
to
could
it.
do it while like while Deonna's speaking. I could do it.
Okay.
I could put the link.
Yeah, I haven't found it yet, so if you could do that afterwards,
Sure,
that'd
I'll
be great.
put that as a little reminder for myself. So, okay.
Thanks.
So we know that a lot of you are doing, especially clinical practitioners, are doing social work via telehealth, either via telephone or via Zoom, WebEx, or another virtual platform. And we've actually adopted VoteER so that you can actually use this via virtual platforms. So if you're doing it by phone, you would use the text code VOTE-SW to 34444. But if you were doing this via Zoom, if you put this up to your window, I've tried it, the person can actually scan it still and it'll work. So if you do it, if you put it in your phone right now, it would work. And we do have we have scripts for that on the website. This is the direct website telehealth. I can put it in the chat a little later. And I would bookmark it just to make it easier. And then I would prompt the conversation because it's unlikely that they may actually see this via Zoom versus in person. So you might want, I like to use the technique before you go. So right at the, like before you go, we know it's, COVID-19 been hard, but have you remembered that you need to register to vote or that have you remembered, this election is really important. And, I want you to have your voice. I want you to have a voice in this election. And will you be able to register to vote? There are different ways you can prompt the conversation. There's one way, are you ready to vote? But usually using that before you go technique is really good via telehealth. The same via phone, except you would give them the text version of that. And then because we have less than 3 weeks, we realize that there's no time to ship this. You need something now. So my recommendation is to actually not order this right now because it's highly likely that you'll get it by the time a lot of the voter registration deadlines arrive. What I recommend you do is to use our democracy stat toolbox, and I will provide the link to that shortly. And there are 3 steps that you can do. One, you can change your phone background to this QR code where it actually says there is a vote SW, not a vote health to 344, but you can actually put it on your phone so that people can scan your phone. If you're cool with that, if you allow that. Then there's the email signature. And actually evidence has shown that if you indicate like this is how you can register in your email signature, that people are more likely to register to vote, to request an absentee ballot. So the email signatures do work, especially with your patients and clients who you send emails to. But if you don't want to use your phone as the background, what you can do is actually print it out and with the vote SW to 3444 and create a digital file of that. So those are 3 tools that we offer in the democracy stat, your immediate toolbox. And making sure your clients have a plan to vote. So for instance, making sure that people are able to vote early by mail. We recommend submitting the absentee ballot no later than 2 weeks before Election Day. Our motto is request early, return early. So some people can do it through their post office. Other people like to do it through the ballot box at their city town hall or wherever those boxes are stationed. Then there's vote early in person. It is a relatively low public health risk, but of course the decision ultimately depends on your individual health status. But not all states offer voting early, so you have to know whether your state actually offers that. But if you're going to vote on Election Day, we call it a last resort because we're from the healthcare background, and we realize that there's more risk to you actually going to vote during COVID-19. But if you do have to, arrive at the polls when you can avoid the lines, wear a mask, and stay socially distanced. So this graphic, I think it's available on the VoteER website, but this is just something that to kind of keep in the back of your head as you're talking to clients about the different ways that they can vote safely. Oh, I skipped a slide. Okay, so hopefully I'll get some of you mobilized. Hopefully some of you are mobilized. This is kind of working on that vote, that triple your vote. It's called social work text banking. I've done it as a participant, and it was actually a lot of fun, and it went really quickly. It's only an hour, and it goes really quickly. And this is gonna be the first time I'm actually directing it. It's a really fun, fast, and easy way to check if people in your immediate network, so your friends, your family, your coworkers, are either registered to vote or know how to vote via email, vote via mail, or in person. But they're sending that absentee ballot over, for instance. We're doing two. We're doing one this upcoming Saturday, 3 to 4, and one this upcoming Sunday, 5 to 6. It doesn't matter what state you're from. Everyone is welcome. You can bring a friend if you want. They don't necessarily have to be a social worker. And you can sign up for either or both by going to that link. I will put that link also in the chat. I'm going to be putting a lot of links in the chat. So, so I'm going to be putting all these links in the chat. So these are just really common links that provide more information. The Watch Kit video that provides more information on how to use the kit. Then we have a social work landing page, the telehealth page, some scripts. The scripts all say patient. They all use that term patient, but you could very much use it in terms of a client make some tweaks and adapt the scripts. There's also a social work media toolkit, that we have. And then some additional resources in, of course, the voter democracy stat. You can also follow us on Twitter and on Instagram. We're really active on social media. I thankfully have 2 interns from the Boston University School of Social Work that are working on additional social media and are going to be working a lot with me on the program evaluation side. So determining how effective this was for social workers. So we're going to be interviewing, doing surveys of social workers that have actually used the kit. Really excited about that because I really want to know how social workers actually use this kit. All I know is that they used it, but I don't know how they used it. So I'm really looking forward to doing the program evaluation side of this. And that's it. I'm going to stop sharing my screen. While Deona's speaking, I'm going to put some of those links in there in the chat. I don't know if there are any more questions or, oh, thank you, Jeff. Thank you. That's the general link for the Healthy Democracy Kit. I don't know, were there any other questions that came up or?
Nothing
Okay.
yet, but we can take a moment to pause and see if questions come up while you're putting those links in. So Tanya and Alberto, if you want to send me your slides, I can tell them to the folks that are on this call, and I can also link them to the Road to November website on the NASW New Jersey page. That way people can access them there too. And that'll be another great way for folks to get this information.
Great, no problem.
And also for those of you who are watching the live stream on Facebook, I'm going to take all these links from Alberto and I'm going to put them in Facebook comments as well so that people can access those. So those are getting added right now and you'll find them in the comments field. Before we move on to Deona, and if we wait while we see if any other questions come in for the chat, one of the things I was wondering about, Alberto, is so VoteER is clearly very embedded in the healthcare system. For social workers who aren't working in the hospital system someplace, is this something they're able to participate in as well? Can social workers in agencies or in private practice?
Yes.
these kits as well?
Yes, and we're working on trying to create better mechanisms, trying to create better ways that this actually is more appropriate, more tailored to social workers. Most of the people who are, I consider the architects of ODR are all medical professionals. So that's going to be like their slants, that's going to be their angle. But they recognize that social workers were like the catalyst for this. As I said in the story that I shared about how Alistair got the idea of creating VODR, he really wanted social workers to be central to disseminating the message, and social workers to be central to those who are involved and to those who are committed to this mission. So we're working on making social workers more center stage, and creating more techniques and more strategies within VODR that are more tailored towards social workers. I think we're going to get a little bit more of that when we do the program evaluation, and we're going to get ideas from actual social workers that have used the kit and just what would be better for them, what would be more appropriate for them in terms of use in clinical settings and university settings. But I will say that, like I said, the students, my own students, have used this tool in their field placements, and they have very, very field placements, and they said it's successful. So it is very translatable. Even though it's used in a lot of medical settings, it is very translatable, and people can use it all across various contexts.
Thank you so much, Alberto. And I see Tanya just put a link in the chat, a voting is social work link. Do you want to just say briefly what that is? And
I put a fact sheet that includes some of the things that Alberto mentioned in terms of the practice of voting being good for the communities that we serve. I mean, we are never going to create a more just society without voting and without full voter participation. And so it's our most powerful tool, as the late and great John Lewis said. But I also, I put in there also an article from NASW's Mental Health Committee that for those of you who are clinical social workers, to help you think about how you navigate this in your practice. Not doing it at all, I pulled together a group of clinical social workers, and we examined the code, line by line, and really unanimously came out looking at the code saying social workers have an obligation, and it can look differently in every single situation. And we obviously meet clients where they are. But what I love about VODR is that it's easy and it's accessible. And because the medical establishment is using it, it legitimizes this. I think it has gone a long way to helping all professions look at their role in nonpartisan voter engagement. So.
Thank you both. That's fantastic. I guess one other thought that I had before we move on to Deona, I guess one of the things you mentioned, Alberto, was that when they established VODR, there was the founding principle that voting is a social determinant of health. And I think that that's so important. And I hope that that thought is disseminating its way through social work education and through social work practice in other areas, so that people realize that, whether or not someone is voting, is engaged civically, is a social determinant of health. And I definitely see how Vote ER can be brought into many other facilities and locations where social workers work, and really help get that message out to the folks that may not be voting. I think Tanya had said earlier when she was talking about the 100 million who didn't vote in the last presidential election, that they were predominantly lower income, lower education, so a lot of non-white population. So we're dealing with a lot of underrepresented and under-resourced populations to begin with. And to be able to introduce the concept of voting and engagement civically when folks are at shelters or social service agencies or domestic violence shelters or any place like that, food pantries. I think to begin to implement that mindset is really powerful. So I hope that that folks that are on the webinar now or are watching the archive version may consider bringing this mindset into the areas of social work where they're situated right now.
So Jeff, I should have said this before Tanya reminded me. So VoteER is a 501c3. We are a nonprofit, so we are non-partisan. The strategies that we use and the techniques that we use, they're not meant to tell people who to vote for, and we're not asking social workers to do that either, or medical professionals to do that either, and to violate their own code of ethics necessarily. But there are a lot of misconceptions that are involved with registering people to vote in nonpartisan ways. The Nancy Humphreys Institute Voting Social Work does some really great dispelling of myths regarding nonpartisan voter registration. We totally, I definitely encourage you to look at their resources, dispelling some of those myths. But the three populations that Dr. Martin mentions a lot to me in terms of people who we need to do more outreach to are people of color, low income, and Generation Z. So those people that are like 18 to 25, and even those people who are not yet 18, but are gonna vote soon, how do we further engage them? So those are three populations that we've been focusing on. We've also been focusing on priority states, mostly swing states like Michigan, Wisconsin, Arizona, and doing a lot of outreach work there. But our efforts are in every sense nonpartisan, and we really do want everyone's voices to be included.
Yeah, thank you. That's a great point. In that, the mission is really to empower people and to get them engaged so that their voices can be heard. We're not telling people who to vote for, and while we may have our preferences and our opinions, that's not what voter registration efforts are about. And thank you so much for bringing that up, Alberto. We've got about 15 minutes left. I want to turn the panel over to Deona to talk about the newest initiative that's launching out of Social Work Helper. I can put the link in the chat and in the Facebook while you're speaking, Deona.
All right, well, thank you. I'm not going to take long, but there is a couple of things that I do want to cover before I talk about the campaign. And one, voting registration is not something that is partisan, but the act of registering people to vote has become a partisan issue, because when more people vote, it has done well for Democrats, and when less people vote, it has done well for Republicans. So the act of registering people to vote has been politicized as a point to win, which is why voter suppression, redistricting, census, all of these issues are starting to tie into who has the power and the ability to vote, because not everyone's vote is equal. So with that being said, I also wanted to bring up the National Voter Registration Act, which in this act, and I put the link also in the chat, section 13, not only are social workers ethically required to help people to vote, they're mandatedly required to help people vote. Social workers, whether you're in private practice or not, you're often using Medicaid billing, which is a public access payment for people in need. And people who are getting public assistance, whether it's through food stamps, whether it's through WIC, whether it's through Medicaid, or whatever public access assistance, those providers are mandated to help their clients register to vote under the National Registration Voter Act. It's not just for DMV, which most people think is for, the DMV are the only ones that's kind of required, but no, Health and Human Services fall in that umbrella as well. So we have to not only speak to our ethical requirement to help people register to vote, especially the most vulnerable, but we also need to speak to that it's also a legal requirement. This is not something that should be politicized, but to help empower people to have a vote on the policies that affect them the most. So I think that's important for us to do. And also too, a lot of people have become extremely apathetic towards the vote. So we're not just fighting an empowerment issue, but also an apathy issue, because people don't think their vote counts. They don't think the system is, they think it's rigged, and that it's not a system of equity. So, which is also promoting a lot of people of color and those who are really affected by it not to engage. And so there are multiple points, from suppression to, purges, all these different techniques to prevent people from exercising their right to vote. So our battle to get people to vote is an uphill one. And so I'm encouraged with some of the things I've been seeing from early voting. And also here in North Carolina, 20% of the people who have never voted before have already voted in early voting. So that's encouraging, especially for our state that has went through so much voter suppression, really surgical efforts to prevent college students, the elderly, the disabled, and Black folks from voting. I mean, we've had multiple court cases and multiple injunctions in place now. So with all of those battles, I'm encouraged that things are getting better. And so Voting is Social Work is a great website. All throughout the year, every year, they're constantly adding and putting information to their website. And I do recommend that as the best resource for social workers throughout the year. And also what Voter ER is doing with voter registration and the way that they have expanded, I actually recommend it as the best tool for registering different multiple access points. Also with Social Work Helper, there are a few tools that I have added to Social Work Helper, and it's just to, here in North Carolina, technology is a barrier, and internet is a barrier. Smartphones having access is a barrier for a lot of people. So with Social Work Helper, I use an email-based system through Rock the Vote, and that's just to help capture some of those folks here in the South who, may experience some of the barriers and may have access to email, but not have access to, regular phone service. So Take the Pledge to Vote is the website that I've created. And basically what I'm going to be doing, all the resources that was mentioned through this webinar, is going to act more as a portal, not necessarily provide tools, but direct you to tools that I think are best suited to get you to the right place that you need to go when you want to check your status for your voter registration, if you want to know what your polling location, if you want to know what your early voting dates are in your state. Reach Voter ER so that you don't have to carry a pocket or a pad with all these website addresses. We're going to try to create one website that helps get you everywhere. So it will be more like a subway system and not necessarily a place to provide a lot of tools. I'm not going to do that. I don't believe in duplicating efforts, but I do feel like collaboration so that we can have an access point. I think Social Work Helper functions best being a pass-through, and so that when I can direct people to one location, it helps. It's like Walmart. That's why Walmart put out so many businesses, right? Because you could go to Walmart and you can find everything versus having to go to, an electronics store or a toy store. So having that one place, that one-stop shop to find everything you need is going to be good, especially when we start pushing traffic to help people register to vote. But the main thing that I want to promote is the campaign to create awareness so that we can try to destigmatize and remove the myths that social workers specifically helping people to register to vote is not a partisan issue. It's actually being a good citizen and being a good social worker to not only think about the work that we do, but how we serve our clients and how we want to empower their voices. So Take the Pledge is part of all the partners, which, the website is not completely finished, but it will be later today. But our goal is to really use social media and email-based, because I think Voter ER is doing an excellent job already on the smartphone, text-based QR codes. So this is kind of low tech, an additional low tech, and we'll be putting all the Voter ERs and voting and social work portals on there later today. But if you're not as quite as high tech and don't have access to those things, you can still use an email base to register to vote through Rock the Vote. And also, we want to encourage people to download the pledge sheet, tell us why you're voting. Also, feel free to add your own logo on there, because what we want to do is, create a collaboration for collective impact, that we're all in this together. And if we can take that approach, I think we could have collective impact, which is what Voter ER and voting and social work is already doing. So I'm just extremely grateful to be able to help promote these platforms in order to help people register to vote. So that is all that I have to offer. But, if you guys have any questions or anything, we're going to be sending out emails to everybody, so it'll be easier to share this email and also on social media, and try to help you guys get these websites and these portals and this information to people so that they can prepare and meet on or before November 3rd, vote. We really want people to vote early and make a plan. Use early voting in your state. Matter of fact, early voting opened up for us tomorrow. And so we can no longer online vote in North Carolina, but as Alberto stated, is still available in some states. So we still want to try to reach out to those states. So even though it's not necessarily a GOTV campaign, it's more of a here's how you prep for November 3rd campaign. So your early voting dates, you find your polling locations. If you want to become a poll worker, that information is there as well. If you need to know your early voting dates for every state, that information is there as well. So if you have any questions, feel free to let us know, and just thank you for allowing me the opportunity to be able to help share this information. You on mute, Jeff.
I'm on mute, sorry. Thank you, Deona. I was just saying I shared the Take the Pledge page from my computer while you were speaking, so people could see the page and all of the information that's available there, the early voting dates. I actually went online for Become a Poll Worker and submitted an application to become a poll worker today. It was really easy. It navigated me right to my state, New Jersey, and to my county. And in a couple of strokes and with a little bit of information, I'd submitted an application. So hopefully I will hear back from that. But this is a great resource, yes. Deona. We've got 5 minutes left.
Alberto, the page that you had, the link for where the triple vote, the register to vote, and I think it had a third option. What was that direct link? If you can send that to me.
Yeah, I could actually send it to everyone.
Which one was it specifically? So I can.
It was actually one that I didn't give. It wasn't on that list, but okay. I can give it. I can give it in a minute. Yep.
All right. Go ahead, Jeff. That was the only question I had. So that's the one I wanted to direct link to the website so that they can have that as the registration option.
Great, and I'll collect all the links and we'll send out an email to everybody that registered so people can have that information. as we're getting ready to wrap up, as I said, we've got about 5 minutes left. I don't know if there are any final questions for any of the panelists. If there are, feel free to type them into the chat. While we're doing that, I want to thank the three of you for being here today. This was really informative, and there are a wealth of resources out there that you've all made available to us. So this is fabulous. For those of you watching here in New Jersey, I will remind you our deadline to register to vote has passed. It was on the 13th. But as all the panelists said, there are still states that you are eligible to register to vote and still vote in the November 3rd election. So for those watching in other states, if you're not sure of when the deadline is, you can find that information through the pledge website that Deona set up. And voting is ongoing in New Jersey. We have an all vote by mail election. There will be some limited in-person voting available in New Jersey. However, we are in the midst of an election. You can cast your vote now. So when you make your plan, get your ballot, fill it out, plan where you're going to drop it off, and do that. Make sure that your voice is heard. I don't see any other questions coming in.
Jeff,
So
I just wanted to say, I put
please.
What Deona was asking, I put it in the chat. It's what this, when you scan this, that's what it goes to, that voter-er.org/LMS. So that's where it goes to.
Great. Thank you so much. And so just as a reminder, we've got a couple of more webinars in the Road to November series coming up. Next Monday, October 19th, we'll be joined by Jesse Burns from the League of Women Voters of New Jersey. And we'll be presenting a webinar on safeguarding your vote, about voter rights and voter suppression tactics that you may encounter in New Jersey. And then our newest webinar that we've just added, October 26th, is very New Jersey specific, but it is a webinar that will interpret the 3 ballot questions that are on New Jersey's ballot. We'll present them for you in plain language so that they're understandable, and also explain what the impact of a yes or no vote would mean for those ballot initiatives. And we'll also be presenting that in both English and Spanish in conjunction with the organization Lupe Fund, who will be on that call with us and with the League of Women Voters as well on the 26th. So thank you all for participating. Get out the vote, triple your vote, let your friends and colleagues know, remind them that we need to vote. This is an important election. However you vote, it's going to be consequential, and you know, we've got to get as many people out there and engaged as we possibly can. So thank you all very much, and we'll speak to you all soon, hopefully. Bye.
Thank you so much, Jeff. Thank you, everyone. Thank you, Deona,
for having us. Thank you.
Tanya.
Thanks again,
Take
everybody.
care.
Nice to be with all of you.
Same here.